Hello, War Eagle. My name is Skylar Moore, and I'm a nurse practitioner at the Auburn University Medical Clinic. I've been a registered nurse since 2008. I've been a nurse practitioner since 2012. I've been employed by East Alabama Medical Center for the last 12 years, as well as I'm a adjunct professor in Auburn University School of Nursing nurse practitioner program. I love what I do. I eat, I live, I sleep, I breathe, and I dream of getting to take care of others. I've never, ever dreaded going into work. You can ask all those I love. It's not a job to me. It's doing what I love. That all changed though 5 months ago when this awful virus hit the community that I love and the place that I call home. I tell you these things so I can tell you the story of a nurse practitioner that's fighting on the front lines of COVID-19. It's my story. Part of this is so funny to me. It's the fact that I went to school for most of my life to take care of others. Some people say that I'm addicted to school. I've got almost every degree that you can get in nursing, from an associate degree all the way up to my doctorate of nursing practice. But nothing could have prepared me for what I've seen in the last 5 months and how the healthcare world and field as I know it has changed. This virus has affected all of us. It's affected you, it's affected me, it's affected loved ones, it's affected anybody that comes in contact with it, as well as those that are quarantining and self-isolating, those that have stayed in their homes and tried to not get this awful virus. Last summer at Auburn University Medical Clinic, we would take on average 200 to 400 phone calls a week, just with questions of incoming freshmen wanting to know where to submit their medical form, to those patients just calling to make an appointment. Last week, my coworkers and I took over 10,000 phone calls. Yes, I said that right. Last week alone, we took greater than 10,000 phone calls in a week. We also tested greater than 900 patients, as well as try to take care of those that we normally see in our office with chronic illnesses. It was a big week. It's been that way for a while, as we have seen the last 2 weeks with the highest number of COVID-19 cases in Alabama, as well as the highest number of deaths related to this awful disease. This is what I ask of you, to realize that we're doing our best, that those on the front line are putting ourselves in harm's way to take care of you. Even my bosses, who are working longer hours and working harder, sending us articles at 6 a.m. to read to make sure that we stay up to date, have taken a 10% pay cut just in order to keep us, their employees, with a paycheck. This virus has affected everything that we know. It's affected me physically, it's affected me mentally, it's affected me spiritually, and it's affected me emotionally. I've had to run miles and miles just so that I can pound on the pavement out my fears, the fears that, am I going to be the next person that contracts COVID-19? Will I stick half of my body into a car of a potential positive patient? Am I looking into the eyes of my coworker, the coworker that might be the next COVID-19 death statistic as they put themselves in harm's way? I also have the fear of, am I going to get a phone call from Northeast Alabama letting me know that one of the people that I love the most, someone in my family, has contracted COVID-19, are scared, alone, and on a ventilator in an ICU. Like I've said, I've went to many years of school, but nothing has prepared me for this. What I'm asking you is that I need your help. I'm begging you, actually, to please help me. If not for you, do it for me. Do it for every one of us that's on the front lines fighting against COVID-19. Do it for your fellow neighbor, and do it for those that you love. These are the things that I need you to do for me. 1, please wear your mask. 2, please, I beg you to socially distance. 3, wash your hands. And 4, please help me lift the morale of my coworkers, the ones that I see, and all the nurses and doctors and pharmacists and environmental service people that I saw the world show that we were healthcare heroes, to now we're the monsters wanting you to wear a mask, or the conspiracy theories that this virus just is not real. Please, I beg of you, I need your help. I'm going to leave you with one more thought. It's my favorite quote. It's been my favorite quote my entire life. I used it at the pinning for my speech in 2008 as I became an RN. It's by Ralph Waldo Emerson. To know even one life has breathed easier because you have lived. This is to succeed. So I ask you, will you wear your mask, socially distance, wash your hands, and help lift the morale of those people that are my peers and my coworkers and those that are fighting hard to learn more and more about this virus daily? Will you wear a mask and help us breathe a little bit easier? I challenge you to put on your mask and make a sign and put on social media the reason that you mask and use the hashtag #IMaskForOthers.